Today we are going to discuss about malaria and its diagnosis. Malaria and its diagnosis. Malaria is caused by destruction of red blood cell with a protozoan parasite of genus plasmodium. Malaria is caused by destruction of RBC, red blood cell, with a protozoan parasite of genus Plasmodium. There are 4 species of Plasmodium. They can infect human being. Number 1, Plasmodium falciparum. Number 2, Plasmodium vivax. Number 3, Plasmodium ovale. Number 4, Plasmodium malariae. There is 5th one species of Plasmodium called Plasmodium knowlesi. Plasmodium knowlesi, that is the 5th one species of Plasmodium. Human infection with Plasmodium knowlesi is reported in the forest area of Southeast Asia. For diagnosis of malaria, one is clinical diagnosis. Second is the parasitological diagnosis. Clinical diagnosis and parasitological diagnosis. The first sign and symptoms of malaria are always non-specific. Malaria is suspected clinically on the basis of fever or a history of fever. Fever is intermittent. Fever is intermittent. I grade. Fever is intermittent. I grade associated with chill and sweating. Dengue and enteric fever must be ruled out in the endemic area because the close differential diagnosis of malaria in the endemic area is the dengue and enteric fever. Dengue and enteric fever must be ruled out in the endemic area. Some patients of malaria may be presented with abdominal symptoms such as diarrhea. Result in shock that is called algid malaria. alleged malaria. Patient presented with the diarrhea with vomiting, result in shock called alleged malaria. Clinically, patient may be anemic, jaundice, and may have splenomegaly, indicate hemolysis. Other method for diagnosis is the parasitological diagnosis. There are two methods for parasitological diagnosis. One is light microscopy. Second is rapid diagnostic test. Light microscopy, it can help us, it will quantify and identification. It quantifies the parasitemia and identifies the species of plasmodium. It can also detect the other causes of fever. But light microscopy, it needs well-trained, skilled staff. So it is not possible to do light microscopy in the endemic area, because you have a source of light to plug in. You must have well-trained, skilled staff. The second method is the rapid diagnostic test. It detects the plasmodium species antigen by ICT. Rapid diagnostic test, it detects plasmodium species antigen by ICT, by immunochromatography. Rapid diagnostic test, this is more specific in the endemic area. It does not need any well-trained, skilled staff. It does not need any source of light. And interesting thing is that there is no false positive. It is highly specific in the endemic area.